to Parkinson Place and our Power Hour with Dr. Gonzalez. My name is Susan Belisi, and I am the Program Director here at Parkinson Place. Dr. Gonzalez, for those that don't know him, he's a fellowship-trained movement disorder specialist with Intercoastal Medical Group, and we are proud that he is our medical director here at Parkinson Place. We are excited to announce that each month, Dr. Gonzalez will be conducting 2 classes. One is called Ask the Doctor, which is a Q&A for men and women who are living with Parkinson's. It's a great opportunity for our peer group, both men and women, to ask questions directly to the doctor. That's going to start, and that will always be the first Tuesday of the month, and it will start October 5th at 1 o'clock. Another one following it will always be the second Tuesday, is another program which we're bringing back called Ask the Doctor, which is a presentation series, and each month Dr. Gonzalez will have a subject. And today's topic, as we know, is the latest on COVID and PD. So welcome, Dr. Gonzalez.
Thank you, Susan. Hola para todos los pacientes que tienen Parkinson's. Estamos celebrando nuestra fecha, nuestro mes de octubre, y estoy celebrando hoy Parkinson's, y mis pacientes con Parkinson's están muy cerca de mi corazón porque soy latino, hispano. I said, welcome to all my patients and Hispanic patients. So we're celebrating our Hispanic month. With no more introduction, I want to start with our topic today with COVID-19. So there is a lot of things about the COVID-19. So we got the presentation. Susan, you went to the first one, what the coronavirus. So this is not a new virus. Before we have a family of the coronavirus, the SARS, that was the severe acute respiratory syndrome. As well, we have the Middle East respiratory syndrome, or MERS. That was in 2019. And in 2019, actually, unfortunately, we had this virus that came especially from Wuhan in China, and then has been spread to all the world, including the United States. So we getting, they have been changed our lives, and has been a lot of impact in chronic conditions like Parkinson's disease. We're going to see really what the symptoms are, include you right now. And this is very, historically, it's very important to see what's going to happen before this and after the pandemic. You have to remember, like almost 100 years ago, when we have the Spanish flu, when some people presented like now with decreased sense of taste and sense of smell, which is very usual in Parkinson's, and many of them develop Parkinson's or Parkinsonism. So we want to talk about that in this talk a little bit. So it's very intriguing for me to know what is going to happen later on when people start developing more Parkinson's after this pandemic. We're going to go to talk about this condition that has been definitely worsening the symptoms of Parkinson's. They can definitely increase the mortality in Parkinson's disease. So if you have advanced Parkinson's, especially, you are in high risk to die. So that's the importance today to talk about the vaccination. As well, sometimes just getting the Parkinson's disease, they can make the symptoms worse. You are not in that stage, so you are very advanced. And sometimes we need to make some change in your medications. So I reviewed this article that appears in the Movement Disorder Journal, and you can get free access. You can see in the screen, and this you can have an access to this slide. So please pay more attention. You can get the whole material, and I know Susan is placing these presentations in the website. So we can go to the next slide, please. So that's what I made the reference to this article in the Movement Disorder Society, and that was is up to date in 2020, and it's in the Journal of the International Parkinson's and Movement Disorder Society. Let's go for the next slide, Susan. Okay, so the SARS-CoV-2 is not only a risk for Parkinson's, but another neurological condition. And nowadays we're getting multiple people having not only with the coronavirus, but with the vaccine, some concerns. So we want to talk about that. So there is a multiple studies looking for what's the impact of the COVID-19 in the nervous system. So many people think about the COVID-19 only like a respiratory problem, but is happening to after having people being in the ICU. My cousin just suffered from this, and he was in the ICU. I have a seizure, and many people that have the COVID-19 coming to us after having significant cognitive problems. Some of them complain again about the decrease in sense of the smell. Some of them will have a seizure. So we have to see as well not only what happened after the fact, or we have to see as well how many people will develop Parkinson's after that. So you see, besides some cases reported for possible Parkinson's, people have been having strokes. People have decrease of consciousness, seizures. It's very common either with the COVID-19 or with the vaccine, sometimes Guillain-Barré. Some people have some paresthesias, some symptoms very similar to a neuropathy or epilepsy, and ischemic or hemorrhagic strokes. So beside that, we see that definitely there's an association about COVID-19 and worsening symptoms of Parkinson's disease. So let's go to the next slide, Susan. This is probably the most important slides about our conversation today about COVID-19 or SARS or and Parkinson's disease. So several studies have been showing or reporting that Parkinson's disease are very susceptible to worsening symptoms. Just having Parkinson's per se is going to place you in a risk like an autoimmune disease to have the COVID-19. But if you have a severe Parkinson's, definitely that can increase your mortality. So because you can understand the risk of having pneumonia, you had difficulty swallowing, you had more likely with the coughing, and then you have an aspiration pneumonia, then the risk to be in the hospital for a longer time, that will be a problem. So the pandemic is something that, as the name said, is affecting everybody. So one thing or one action you do is going to affect everybody. So that's, many patients ask me, my son wants to visit me, he's not vaccinated, I'm vaccinated, may I allow him to come? I said, it's risky, you need to continue with the social distance, and be sure you tell them that if they come and they are not vaccinated, they can place you in a risk for you to be sick or even to die. So that's something that's very important. So I want to make a point that the risk of mortality depends on the severity of the symptoms of the COVID-19 and the stage of Parkinson's. So that's something that you have to understand. You have a Parkinson that is mild or moderate, usually does not, the risk of dying is not as different as the general population. However, we have some studies in Italy that showing that some cases with COVID-19 showing significant worsening symptoms in the motor and non-motor symptoms in Parkinson's. So this is, and again, this is not only applied to COVID-19. We're seeing people every day having Parkinson's and for some reason need to go to the hospital for a sepsis or something. Then usually we see there is a significant decline. But this is a little more than that. We see this is a virus we are fighting, and we have to learn, and we don't know what's going to be the outcome. So it's very important to know that COVID-19 can produce exacerbation or pre-existing symptoms of Parkinson's in about almost 60%. Let's go for the next slide, Susan, please. So talking about this, so we have to look, this is not only the COVID-19, but another virus before had been issues producing additional problems in the brain, like the West Nile, the herpes virus, the influenza, the HIV. All of these have been associated in the past as well with Parkinsonism. So this is one of the secondary etiologies for Parkinsonism. We are thinking of Parkinson's disease like idiopathic. Idiopathic, again, when you come to my office, I've said idiopathic is a word that we use in medicine that mentioned that we don't know, that we just don't have a clue what is happening. But it's a small percentage of the cases, this virus, including the COVID-19, probably potentially can produce Parkinsonism. And in the years to come, we probably want to find more people after having the COVID, having Parkinsonism. But again, this is not only with this virus. In the past, the West Nile herpes virus, influenza A, and the HIV as well have been associated with Parkinsonism. Okay, so some study have been showing actually after having the COVID-19, people having the DAT scan that we do for, sometimes we have some suspicion of Parkinson's or Parkinsonism. And actually it does studies that was done in one group. It showed that there is definitely significant decrease of dopamine. So another study have been showing that people after recovering from symptoms of pneumonia, they report one lady of 35 years that initially it showed unilateral bradykinesia, hypophonia, generalized rigidity, and decreased facial expression. It sounds very familiar to you. Yes, those are the symptoms of Parkinson's. So they give you some treatment with levodopa, and usually secondary Parkinson's, they don't improve that much. But in this case, they report that actually they improve in the score that we do for Parkinson's. So this is a very good example of what happened with this virus, as not only making the Parkinson's worse, but it could be the reason for people develop Parkinsonism in the future. Let's go for the next slide, Susan, please. Okay, so in this article, again, that has been published in the International Society of Movement Disorders, show that at least several cases have been reported for a beginning of Parkinsonism after having the COVID-19. So they didn't have these symptoms before COVID-19, and they didn't report any previous family history. They did another screening for genes related with Parkinson. In John said, or there's a very small percentage of Parkinson that could be genetic. So they did all screening, and they were relatively young. So you see somebody young that is not 60 or older, or is like 40 or less than 40 years old, you're wondering, and genetic, or in this case, we're looking and seeing many new people with Parkinsonism. So as well, these people, they have a REM sleep disorder that sometimes is associated with Parkinson's, constipation or depression. So this is important, not only the motor, but no motor symptoms. Please go for the next slide. So we don't have a clear link right now. And again, we have some reported cases, but I think the more we start knowing this virus, we're going to find more link between this virus and the infection or secondary Parkinsonism. Okay, so we'll see what's the role of this virus and producing more specific neuronal degeneration, especially in the areas that can produce Parkinson's, that in the basal ganglia. In some cases, they have been proposed that there's some areas like in the oculomotor nucleus and in the dopaminergic neurons. So there are some markers for Parkinson's, so we have to look in the future. And I'm sure that we'll do some autopsies and look for the alpha-synuclein, or that scan showing more and more evidence of this link. So more studies and not only some case reports are necessary. We need to involve more research in the future. So there is a lot of things we want to start knowing from this virus in the future. For example, with the acute West Nile virus infection, there was as well association with increased alpha-synuclein. And interesting enough, you have to remember that back on the 100 years ago, we started medication, amantadine, that we're using now. that not only we give you for people having the virus or having the flu, in this case, the West Nile, and only people was getting better with the Parkinson's or Parkinsonism, but as well from the flu or from the virus. So you see that another virus, like the talking about the Hispanic, we talk the Venezuelan, Akin, West Nile virus. So there's a different virus that can produce this situation. Please go from the next slide, Susan. Okay, so in this slide, we're talking again a little more about alpha-synuclein. So the alpha-synuclein is a misfold protein that we found in Parkinson's. We know this etiology of Parkinson's disease. Again, it's a misfold protein. When some proteins come to try to fold this protein better, and it's not accomplish the task, then this start being and toxic. So that's the way how Parkinson's or the alpha-synuclein start attacking the cells. So it seems that some of these viruses start producing this protein, and in the end, it's going to produce the Parkinsonism. As well, we have in the past, historically as well, the H1N1 influenza virus, and then we had to be, and hopefully we can have more study in people having this condition, and probably analyze in the future the possible link between the COVID-19 and the virus. And again, you have Parkinson's, possibly you have the COVID-19, possibly you want to have worsening symptoms. You have in very advanced stage, you risk to have mortality is the problem. You are very mild Parkinson's early stage, usually your risk of dying is very similar to the general population, especially you don't have difficulty swallowing. Let's go for the next slide. So how this virus enter to the brain? So usually it can go two pathways. One could be through the nose or through the blood. So this is showing here how the different virus, so especially the coronavirus, can enter to the brain. So they're telling me the different link again for the Parkinson's. Again, the lack of sense of the smell is telling me that the virus is already entered to the nervous system, and then producing this reaction to produce alpha-synuclein, and then start having other issues. And I have many people coming for memory problems, and then we'll see there is any kind of stiffness, lack of sense of smell, lack of sense of taste. So we'll see what happens after that. So those results and these signs are in favor of virus-induced Parkinsonism. So, and the fact that we can actually look DAT scans, or the way we can substantially look for alpha-synuclein in the brain. Let's go for the next slide. Okay, so a lot of people with COVID-19 can develop neurological disorders. So there is similar to another coronavirus. According with some people, some issue with the vaccination because they're thinking that we are rushing the vaccine. But before we have another coronavirus, this is a family, and this is a virus that probably came from the bats. So this, unfortunately, this is from animals to humans, and then we see what's going on and how this virus entered to the nervous system, and they attach to one receptors in the brain, the ACE2 receptors, and that's the target cell. And from that, they start producing interaction with some spike glycoproteins, and then they start producing a lot of cytokines, and the viral start attaching to more brain and brain areas, and then they start producing the damage. So that's part of the way the virus can go. I don't want to more on the specific because I want to produce a little more of the convoluted of this, but this is very specific, and we have big evidence that the virus entered to the brain, producing a change in the sense of the smell, attached to some receptors and the neurons, and they start producing reaction and they start expressing or producing alpha-synuclein. Let's go to the next slide. Okay, so as you see, this virus is neuroinvasive, so it's is getting to the nervous system. So as we actually find the virus in the CSF. So this is has been providing a strong evidence of neurotropism. That we're just meaning the virus like the nervous system. It's like somebody have trigeminal neuralgia or having a post-herpetic trigeminal neuralgia. So that's virus just love the nervous system. People having the shingles, usually some of that virus just love the nervous system. It's their habitat. They just want to sleep in there or just want to attack the nervous system. So in that way, for example, the COVID-19 can produce encephalitis or can produce another conditions in the nervous system, the immunization disease. It's possible they can look like MS, or as well, we see there's another conditions before we talk about Guillain-Barré. Some people have Bell's palsy, some people have cognitive problems. So after the COVID-19, we can look as well post-mortem, looking at the pathology, investigating the brain tissue. And you see here they show at least 43 patients that after having a COVID-19 and there was reported to have in their brain about 53% of these patients have the virus in their brain. And they're looking as well for how they can be cytotoxic for the meninges and how they can have a T-cell infiltration. So basically, the immune system is trying to attack those virus in the brain. So that's part as well of the problem. Again, with the COVID-19 is as well the reaction, the cytokine, this cascade of a very big immune response for the virus. And then this cascade is what produces most of the problems in the COVID-19. Let's go for the next slide, please. So to enter to the brain again, this virus has a neurotropism, meaning they like and love the nervous system. They go initially for the respiratory, so people know about the pneumonia, as well as have been several studies showing that they actually can infiltrate the brain or can go directly to the olfactory nerve system. That is very key. And remember, when you have lack of sense of the smell and taste, that means definitely there's some compromise of the nervous system. But the other way they can to get to the brain, it could be close the blood. So they have to go to that's all virus in your blood. It starts from the nose, from the lungs, and finally going to be in your blood. Go to the next slide, please. So again, this is very important. This virus can, one of the main interests is through the nose. That's why it's very important to use the mask. So they look for, in the study that I use in the mouse models, and they have been looking how this virus attached to the cells, the receptor, the HC2, that glow initially in the nose, and then the virus enters. That's the window of the open of the door to go to the brain. Next line, next line. For the next thing in this slide is say that people have been looking for the COVID-2 the RNA. They're looking not only for the vaccine, but as well we found those viruses in the cerebellum. So it's not only in the front part of the brain, but as well in the part in the lower, in different areas of the brain, producing different syndromes. Please, Susan, the next slide. So going to the going to the other area, the other door for the virus to enter is through the blood. So this there's the other way that the virus can produce other neurological disorders. When we have actually a good barrier, it's like the frontier. That's like the area that can actually avoid the virus to enter the brain. This is a very complex barrier that usually protects us against a lot of infection. And talking about that, the blood-brain barrier is very important. For example, for the carbidopa, the levodopa to go to the brain, you know, that's why we said you cannot take the levodopa with proteins, because the blood-brain barrier is very selective and is very protective. So this blood barrier try to avoid the virus to go there. So there has to be a disruption. There has to be a damage to that barrier to the virus to get to the brain and start the replication. So we've seen a small damage of the areas of the blood vessels, we call the microvascular endothelial cells, and then the door is open and the virus start producing the problems. And go through the next slide, please. Okay, so I want to go to the conclusions, and again, we're going to go to the opens to the questions. There is a lot of information in the Parkinson Foundation questions. Michael Okin in the website get some answers. I think they want to update that soon. At that point, they want to answer some questions about vaccinations, when to have it, what will be the problem. But let me go for the conclusion of this study, this article, which is, I think, is very good, and say that overall this review, we've seen an examined patient with coronavirus that can enter the brain. Usually the main entry or the main door for this is the nasal route, your nose, the olfactory, and it's when people start having a decreased sense of the smell or taste. But there is another route, so I just mentioned to you, the blood-brain barrier. So once the virus enters to the brain, it starts producing not only possible potential Parkinsonism, but they can produce another syndromes. So it's not only inducing Parkinson's, but as well can produce worsening symptoms of Parkinson's. But as well, we have to see that now the evidence or the link, the cases have been reported are too small. So most likely we need to get further studies to look clear the link. But they just listening the history when people had the bad economoencephalitis more than 100 years ago, many people developed Parkinson's or virus-induced Parkinsonism after having the Spanish flu. So most likely the story has been repeated here. But again, we have to get more evidence and more studies after this. So in vivo, we're getting some evidence as well that people can develop Parkinson's disease with the cases that have been reported. But again, more clinical study has to be conveyed. And we have to have, and this is in the pandemic state, it has been from pandemic to endemic. You see now it's going to stay. We have different variants. So we have to see that the more variants we have, they are coming stronger and they will be more effective, and it's affecting a different population. Not the population with Parkinson's, which most of our patients with Parkinson's and the elderly, so they are the ones more at risk, but as well it's affecting the youth. And with the youth as well, the patient has been getting more affected with Parkinson's. I probably want to see more Parkinsonism in that age. So that will be one of our red flags. So in our, and they said in opinion, the early we elucidate the long-term effects of the COVID-19, the better. So again, there's a lot to learn from this condition. And again, if you have Parkinson's or Parkinsonism and your symptoms are, depends on the stage, will be more affected, or you will have more risk to have a more risk of dying. So it's very important and very key to keep you safe, keep the social distancing, be sure you clean your hands, and as well only limit your social interaction with people that you know. And hopefully I encourage people to be vaccinated, because that has been the only thing that has been showing, besides the cover your face, avoid the contact, cleaning your hands, to show a big impact. I just tell you the two hospitals in the area to finish this conversation, and then we're open to questions. I was working before in Lakeland, and they had like 1,000 beds in the hospital. And I just talked with one of the hospitals recently, and they have the majority, or at least 40% of the patients being in house or hospitalized have been people with COVID-19. I invite you to see the statistic that you can get or access to Sarasota Memorial Hospital. And one of those showing a very nice graph, like one of the peaks of in August, people admitted to the hospital with COVID-19 was almost close to 200. The majority of those people admitted to the hospital were not vaccinated. Still, there is some breakthrough, we know people is still being vaccinated could be a risk to be hospitalized or be in the ICU. But the people intubated or be in the ICU or the majority people dying are the people not vaccinated. So I encourage you again to be vaccinated and keep yourselves social distance and keep the interaction only with your family and just protect yourselves. En español, gracias nuevamente por estar con nosotros en esta charla. Por favor, protéjense y vacúnense y vamos a ver cuáles son los adelantos y qué es lo que va a pasar de aquí en adelante con este virus. Okay, that's my presentation for today. There is a lot of material. And you know, every day there is a lot of news. I know you probably have some questions about the booster. I know it has been approved with the Pfizer by the CDC for people more than 65 years old. So you are more than 65 or you are advanced Parkinson's, I recommend to have that booster because you are more at risk of dying. And I know, unfortunately, the levels of the antibody have been decreasing. So that will be my recommendation. So I'm going to stop here, Susan, and we're open to questions.
Okay, I'm looking at a few questions. I'd like to read some first that were put in the chat, and then we can open it up after that. Some of them were answered because some of them were based on whether about the boosters. But there is a question. The report that you had, is that for you only, for public, or for doctors only?
Sorry, what? Repeat again.
The report that you used on the presentation, is that only for doctors' use or is that public information?
Public information. It's something that we got. This is something that's in the literature that people want to hear. That's something that you can use.
Okay. The rest of the questions were based on the booster. So if someone has another question, I'm just going to put it in the gallery view. Please unmute yourself and you can say your question.
Hi, Susan. This is Pete.
Hi,
Hi,
Pete.
Pete.
How are you doing? I do have a question, doctor. I was diagnosed with Parkinson's 4 years ago. Then 3 years ago, I was diagnosed with acute wet macular degenerative for the eyes.
Mm-hmm.
And then I was diagnosed with sleep apnea.
Mm-hmm.
And with macular degeneration, I've noticed my eyes are not doing very good. I just had a surgery and it's taken a long time to recover. Is there any correlation between all these?
Do you get the infection? We don't see correlation with the eyes, but again, any neurological symptoms or issue could be affecting the brain. But the eyes again has some dopamine with the vision, but I don't know if really is related. The sleep apnea usually is not. But again, you have issue with respiratory issues. If you have the virus, you will be more risk if you have an issue with the virus because you already have a sleep apnea. We don't see, and again, in medicine, we cannot say never or always, but there is not anything that they point out to that, but definitely have to look at that, but I don't see any correlation.
Okay, thank you.
Marilyn Sloan?
Yeah, do you recommend that booster 8 months after their second vaccine or go and get it now?
Okay,
For advanced stage Parkinson's, my husband has.
Yeah, the advanced stage of Parkinson's. So the CDC is going to establish, so you have to count the age. So you are more than 65.
Yes.
Number, you have to have the consideration about the stage of Parkinson's. So you have more advanced Parkinson's sooner than later. Or number 3, you have difficulty swallowing or having other complications. With that, probably could be the sooner the better. But be sure as well, it's not too soon, or that it is, you have it like last month or something like that. But the CDC, and again, before we were excited to tell everybody after 65 getting the booster, but the CDC and Dr. Fauci have been going back and forth with different things. So we have to look and get up to date day by day. But I would say, you ask me, my opinion, again, is the opinion, but looking for, as a Parkinson specialist and looking for the group age, where you as well with this article, you are more in risk of dying, but I'm also the people more than 60 years old and getting there this year. So we are a little more in risk to dying because we are more our immune system is a little weaker just because the aging, you are not, our immune system is not as strong and 50 years old. And that's the problem with our youth. They are thinking they are Superman and they don't have infection. So, but we are getting a little older. Our immune system is not as strong, but you keep yourself well hydrated, keep you good exercise, good nutrition, but you are a person that have more advanced Parkinson's disease, you're more than 65, definitely recommend the booster sooner than later.
Marilyn, one more question?
Yeah, I asked about the booster for my husband with advanced stage Parkinson. He's over 65. And I was at Walgreens getting my flu shot. A man came over and he asked about getting a booster. They said he was immunocompromised and they referred him to another Walgreens. But there was just a form to fill out and there was nothing from a doctor. So could anyone just go there and say, I have such and such, I like a booster?
Yes. Actually, we have a memo from Intercoastal and you don't need a letter, but we have a letter, and if you have for any reason some pharmacies so they refuse, we have this letter, we have a form and you can sign it right away. There is no problem. And again, from I had my booster, it was like 3-4 weeks now already, and I want to share with you what's my experience. And I went to the CVS. The one is across Wawa in the Lorraine and 70. I don't know if you're familiar with that, but it's very, very well organized. So they have a form you have to sign for people having some immunosuppression or having any condition you have to sign. They said yes, and then they have to give you, and you don't need an appointment. It's one of my Latino patients told me that they have to have an appointment, which usually is not the case, but for some reason in that particular pharmacy, but usually you don't need an appointment. You have to fill out the form and you have the booster. And now again, you have to follow the guidelines for the CDC. And now at least the Pfizer is approved after you are 65 years or you have any immunocompromise. And this for people more than 65 and you have advanced Parkinson's, I recommend the boost, especially that has been more than 6 months or close to the 8 months.
We consider that immunocompromised, having the advanced stage Parkinson's?
Not really.
Neurological disorder. So
yeah, the thing is more the complication. So you are not considered immunocompromised is the complication. You have definitely you have Parkinson's again because you difficulty swallowing, respiratory. Most likely the Parkinson's again we mentioned before in the talk that you know to catch up back to where you were before, and besides that you are higher risk of dying.
Yeah, thank you so much.
Do you have any idea if Moderna's planning on coming out with a booster, and these booster shots, are they going to be full medication, or are they less potent, or how are they working, these boosters?
Yeah, there is a lot of communication back and forth. One the communication was saying that probably going to go only half of the dose be enough. That's what some people says. Again, the one that has been approved is the Pfizer, and again it's the same mechanism. I hope the vaccine we go for the variants, and it seems in some studies, again it's on the communication we have. Actually, the Moderna seems to be working better than the Pfizer, but it's only one study. And actually, Dr. Fauci was interviewed for that, and he said there was some preliminary. There's nothing that he has to be politically correct. But I think going to your question, it seems that it's going towards the boost. And again, in the next days or weeks, the Moderna will be probably approved for that as well. Pfizer has been approved only. But it seems that probably some people talk about how, but there is not the final word in the stone for that.
I have a comment on that. I was checking at CVS and they are giving Moderna vaccine boosters.
Yes, sir. Yeah, that the same information. If somebody had difficulty, I think that was mentioned about the CVS. They do the Moderna booster. That's what I got. And I was sick for 3 days with muscle pain. But after that, I'm strong and I'm happy to see my patient. I'm feeling stronger to go to the hospital. And I'm protecting not only myself, but my family. That's what we do.
I'm 84 years old. I'm well past the 65 mark. So to have that vaccine.
Are strong, and hopefully we can get to that age. So we have to keep you well and good and safe. So we have to keep you strong.
Okay. Well, thank you, Dr. Gonzalez. It's amazing how much information we've learned in such a short time